Hello, everyone. I'm Brent Huggins, a citizen of the Cherokee Nation, and today we're going to be having a discussion about HIV and AIDS in Indian country and how it impacts Native youth specifically. We are gathered with the National Native Youth Council on HIV and AIDS, and I am the chairman of this council. We've been together for about 2 years now, and we've been doing some really great work. So the council was created, and we seek to advocate, empower, and support Native youth in the area of HIV and AIDS. We're comprised of Native youth through a partnership with the Native Youth Sexual Health Network and the National Native American AIDS Prevention Center. We'd like to go around and introduce ourselves. Shay, would you like to go first?
Hi everyone, I'm Shay Trimble Norris. I'm a Guala Lakota. I'm currently residing in California.
And Alan?
Hi, my name is Alan Felix. I'm a member of the Confederate Salish and Kootenai tribe of Western Montana, and I currently live in Arlee.
And Kyosha?
Hi, my name is Kyosha Peter. I'm Dene, living out in Albuquerque, New Mexico right now.
So we recently conducted a survey with Native youth around Indian country to gather their views and opinions on how HIV specifically impacts their lives every day. And so from that, we're going to have a discussion. And so our first question that we posed was, how much of a problem is HIV and AIDS in our communities?
So the problem with HIV and AIDS in my community is actually pretty high, just because I live in a more urbanized area, so it is pretty diverse culturally. So with the natives who may have contracted HIV, it is very high due to not just sexual intercourse, but also because of drugs, which is also needle sharing. So my area, it is actually pretty high.
It's also high in my area. Within the past year, there has been 15 new cases on the reservation that I know of. And just like with Shay's community, it's through unprotected sex and needle sharing.
In my community, which consists of the entire Navajo Nation, it is definitely a problem because in the last 2 years there has been a drastic rise just within Navajo Nation in terms of epidemiology, and it's been slowly increasing, and again, like needle sharing, unprotected sex, and like through various different mediums as well.
The second question that we discussed was, what are some of the ways people in our communities are contracting HIV?
Needle sharing, and as well as unprotected sex.
That's pretty much the same in my community. Needle sharing, unprotected sex, and not access to educational materials.
The lack of educational materials and a sexual health model that is specific for every Native nation in terms of addressing this issue as both a cultural problem and also a community problem that stems from systematic oppression and from like different structures of power that exists. In terms of education, there's just no working model that can address all Native nations to help eliminate or eradicate this disparity, which, and there probably, my perspective, won't be one specific working model, but it's more so on the tribe's part and the community's part, the people's part, to initiate that sort of model that would best serve their own community, and that way we decolonize.
I think that Kyosha brings up a really important perspective about colonization and the need to decolonize policy. So thank you. Also, looking back at some of the interviews, some people mentioned that border towns surrounding reservation lands may also offer opportunity to engage in risky behavior.
How does your community view Native LGBT youth?
So in my community, it's a 50-50 thing. Some are accepting, some are not, but slowly being taught to be accepted. What also plays into my community is being so urbanized with the diversity. You know, some kids are not really accepting because of some of the people that they hang out with, or see it as a bad thing because of where they were raised. Some youth are okay with it. Some youth are slowly accepting themselves and also accepting others as two-spirit or gay, straight, you know.
Whenever I was speaking with some of the youth in my community, they kind of raised the issue that I think that there's still not complete acceptance with LGBT youth, and that there's still issues of discrimination or looking down upon, which can be a very serious issue. But I think that they did say it is getting better, but more slowly than other places.
In my community, they just see them as other people. They don't see them as any different than any other person in the community. They're very much accepted on this reservation, and basically reservation-wide. I see that.
So in my community specifically, which is at Dennett and Navajo, we have 4 different gender roles, and those 4 different gender roles are based upon different creation narratives and philosophies that we as Dennett people have had from time immemorial. And so the concept of LGBT or Q or Two-Spirit wasn't in existence yet. So when we actually talk about lesbian, bisexual, gay, it's often stigmatized and seen in a negative fashion. But due to resurgence and proliferation of gender identity on part of a lot of Dene people, especially in big populations inside the Navajo Reservation and in urban communities, there's been a resurgence and a reclamation of that gender identity to the point where it's starting to be slowly accepted among the younger generations, but among the older generations it's still very stigmatized, and we don't talk about it as often as we should. And that's where a lot of our underlying problems are held.
What traditional messages about health and wellness can be used to support HIV prevention efforts?
One of the messages that I've heard is your body's sacred to your spirit. It's like if you take care of your body, take care of your spirit.
Because I live such in an urban area, I haven't really heard much of traditional stories. But what I have heard as taking care of the body and whatnot is, you know, if a couple decides to have sex and they happen to create a child, that to make sure that the male is always around, because not only, you know, they had sex, you know, they're creating a life. Take care of the woman, because that woman is carrying the life, she's carrying the child. So it's just basically, you know, common sense of be responsible to take care of, you know, each other.
One of the things that has been used extensively across Indian country is the use of the medicine wheel, and a lot of Native nations utilize that as their central model, especially when talking about preventable diseases, and Navajo Nation uses that as well. But in terms of traditional knowledge, it's also key to know, like, what do we mean by tradition? How does that transfer over to someone who does live in an urban community?
Some of our partners with the Native Youth Sexual Health Network, they've created some really wonderful memes for the internet geared towards Native youth. This has been a really good discussion about what Native youth really think about HIV and AIDS in Indian country, and how it really impacts our communities and the disparities that exist. So we all want to remind our Native youth,
Protect what is sacred.
get tested.
Know your status.